Recording in progress.
Now we can go. There we go. That's the magic here.
Number 4. Yes, let's get started. Welcome, everybody.
Chairman Paul.
Yeah, thank you. Looking for some motion to approve the minutes of December 12th.
I'll make the motion. Chairman?
Any other any comments, questions, hand gestures about the meeting minutes? Well, just ask.
I have a few questions.
Okay. I know you would.
Thank God for Rob.
There we go. On page 2. No, it's not page 2, but I think it's page 3. On number 5. I didn't actually number 7. And there's the acronym FML.
Yep, family medical leave absence. And I should remember to not use acronyms, so thank you.
Any other comments?
Yeah, I think the other acronym was on the last page. And it was the underlying report. I think it was FEI.
No, I don't know what SEI is. I know what STDs is, but I don't know what SEI is. So I'll find out.
All right, we'll have to get back to you on that one.
Can I get back to you? Next month, is that good?
Oh, sure, it's fine.
That's good.
That was the only one I
Last
didn't
month's minutes,
know.
we're gonna just do.
Any other questions or comments? Hearing none, I'll consider the minutes as amended, approved. Cole, do you want to talk about health protective services?
Sure. So I know that's one of the things that we were concerned about was how the lack of staffing is impacting the care that's being provided to residents in nursing homes or care facilities. And so I did a little bit of digging. I don't have a lot of great information, but I found what I could. So the state started tracking referrals to adult protective services in care facilities, not nursing homes, but in CBRFs and adult family homes. I think it might have been like August, September. And unfortunately, they did not have a line item on there to notate lack of staffing insufficiency, and they just added it. So the only information that they could give me was that of the referrals turned into their tracking system, only 4% were because of lack of staffing. But like I said, they just added that line item like a month ago. So it really doesn't give us very much valid information whether a lot of the referrals being called in or how much of the referrals are due to staffing insufficiency. But a couple of the things, I ran our reports, for the year. Some of the things that we learned are fairly interesting. So Winnebago County had 31 emergency protective placements in 2022. That means that 31 times either the police or adult protective services or crisis took someone into the hospital on an emergency basis, saying that basically they were a danger and they needed to be admitted immediately because they were concerned about their and they were not competent. And 21 of them were dismissed. So that means of the ones that we tracked, only 10 went through. Many of them were dismissed due to issues with the court system, rights not being read, and also people being found to be competent once they went to the hospital. So I thought that was a really interesting statistic. It doesn't really have a lot to do with caregiving, but it kind of has to do with what's been going on in adult protective services and how we're really trying to be more proactive, because a reactive approach to jumping in during an emergency isn't really working for us right now, because it's not going through the court system. We did do 127 guardianships, and we did 171 protective placement reviews. That means someone who has a guardian and is in a facility with more than 16 beds. So we did 171 of those. 2 of those that I was able to, I read them all, but this year 2 of them had concerns when our staff went into the facility that there were staffing issues. Only 2 of the 171. So it's a pretty minimal amount considering we're going into facilities, not just in Winnebago County, but everywhere, and asking the guardian how things are going, and the people in the facilities.
What do you mean by everybody? Other than Winnebago County is only?
Everywhere throughout the state of Wisconsin. So if a Winnebago County resident is placed in Wausau, we go to Wausau to visit them to ensure that they're being treated fairly. One of the other statistics is that we had 671 referrals to adult protector, 607 referrals to adult protective services this year, and 605 last year. So there wasn't a significant rise over last year in calls, but the complexity, and I know that Brian has the same issue, the complexity of the cases is just so much more. A lot of mental health, probably a lot due to COVID. A lot of mental health and homelessness is a lot of the reasons why some of the cases were a lot more difficult. And then, so some of the concerns that I've seen recently, where there are staffing issues, there were, and we had talked about this before in a meeting, there was a facility in Appleton where 8 Winnebago County residents were at, and they had staffing concerns, and the fire department had to come in and staff that facility. We went out there for 2 weeks and checked in, and now there haven't been any more concerns that have come in regarding the facility. But of the 8 residents, 2 residents in Winnebago County did have significant concerns. And so the lack of staffing has led to things like people not being ambulated so that they're sitting and their wounds are getting worse. We did have 1 person in Winnebago County die of sepsis due to not being repositioned as often as they should be because of lack of staffing. There have also been 2 calls due to falls because people were getting up on their own because staff weren't coming outside of this incident. So of the 607 referrals, and I don't see all of them, the ones that were brought to my attention, only 7 of them. So I would say not a significant amount that were coming across my desk. Now we are going to be changing things that we do a little bit, so more will be coming across my desk. So I'll see them more on the front end. So I'll be able to in 2023 have much more depth in the information regarding what's really coming through. And then Beth recently went to training or a presentation that she shared with me that I thought had some interesting statistics. And one of them was that they did a survey, and maybe Beth, you know, if you have questions, she can add a little bit more information. But the average turnover rate for caregivers is 62% in the United States and 50% in Wisconsin. And then of those people surveyed, 59% of the people working in the caregiving role were working less than a year and 43% less than 6 months. So that's a huge amount of staff that have been there for a short period of time. The median hourly wage is $13 an hour, and then the three biggest reasons why people reported leaving that job, 73% said pay, 29% benefits, and then 19% inconsistent scheduling. The current data specific to Wisconsin is that 1 in 4 positions are open. So that would be about 25% of positions in Wisconsin are open. And that they are anticipating that in 2024, we will need 20,000 additional home care staff. So,
So do you think that the mental health issue is always there, and COVID could push it into the front?
I think it was, but I think COVID exacerbated maybe underlying mental health issues that people had due to like the isolation and like just the trauma of like that. It's a traumatic event to a lot of people and something that had never happened before. So I think that it exacerbated it maybe existing mental health issues, and also it pushed a lot of people who maybe were on the edge of being impoverished into more impoverished situations, which then led to an exacerbated mental health for a lot of people because their basic needs weren't being met, and just the stress of dealing with that. So I know that in talking to my staff, who maybe used to go into the day-by-day warming shelter and do outreach a couple years ago, they just weren't seeing significant mental health issues when they would go into the shelter. They were seeing maybe poverty or people who chose to be, you know, chronically homeless. And then throughout the last 3 weeks, the county has been volunteering to work at the shelter, and the staff who used to go there to do outreach and who work there were just very shocked at the discrepancy of the fact that the mental health concerns of the people that were at the shelter now they hadn't seen that before when they did outreach there.
For shortage of staff, does that mean do they take, they're supposed to be 9 or whatever, and they're short, they have 7 or 9, and is that what they mean by short of staff, or what do they mean by that?
I don't know. I know I can only speak from the experience of like running a home care company. We would just anticipate like how many referrals we had and that we couldn't staff, and then anticipate that's how many staff we would need. I think shortage of staff is a little bit easier to reflect maybe in a skilled nursing facility, but with home care, it's difficult to reflect because it's how many staff would you need to fill the referrals that you turned away, basically. But a lot of home care companies stop doing their marketing because they can't fill their referrals. So if they were fully staffed, they could probably do a lot more marketing. So it's home care is a difficult number to decide how many staff you would actually need.
And for scheduling, do you find, and this may be a problem for public institutions like parks or whatever, that workers are forced to work double shifts or more than 8-hour shifts routinely? Is that anything they found consistently?
I don't think they talked about it in this study, but I think from interviewing people when I worked in home care, a lot of times they would choose to leave the facility and go to home care for a while because they didn't want to be mandated to work double shifts. But I think that that's the truth for like a lot of positions now, like in, you know, people who work in the prisons, people who, you know, are police officers, and, you know, a lot of people in that capacity that there is a need for staff to be there are being forced to be mandated overtime, people in the hospitals.
I mean, we heard it sworn in my legislative committee, but the prison system, where correction officers have to work 16-hour days, and sometimes 20. Parkview, I don't know if Parkview has, I know like,
They've had, yeah, to require overtime,
I mean, is it 16 or
additional
12?
shifts, that kind of stuff.
And then they have to take off, okay, and then, I know this is what I asked a couple months ago, when I went to a WCA steering committee on human services. And the presenter said there was some care facility that's in where in the state where one morning, no staff showed up,
Yeah,
and that's,
probably the one in Appleton that they were talking about.
that is, I call it the ultimate scare, I don't care if it, well, had private, to go to staff and wake up or you come with no one
Happened
to
2 or 3 times in the state last year.
really, to say, how does that? I guess somebody, intervene and say, okay, either you fix this or we're gonna have to, with all respect, shut you down because we can't have.
Well,
no
and
one-
like Nicole said, it wasn't just us going out there daily, it was Department of Quality Assurance who does the licensing, so it wasn't us just saying, oh boy, we got a problem here. It was a joint effort with Allegheny County, Department of Quality Assurance.
Lakeland,
oh
Community
yeah, the
Care.
managed care organizations.
I guess what I brought up then, somehow, how do we address this issue? And I don't know, the state thought of a need. I guess, yeah. state-
Well, the guy that presented those statistics is also presented some information about what they're doing. So they're looking at a 5% increase to staff and pay. They're looking at ways to expedite, for example, CNA. If you already had it in another state, why are we making go through all the CNA stuff? They are looking at a certification program where staff would go through, I think it's about 40 hours of training to get a certificate so that their pay can be upped and they can get a stipend for that. And that training would be paid for. But the time spent doing it, they have to figure out what to do with. So he presented several options because the state, I said to him, this has been an issue for literally, I age myself, 30 years. I remember talking about this. No, seriously, we talked about this 30 years ago. And I have not seen many, if any, strides toward really truly addressing it. And this is the first time I'm hearing an actual action plan, thanks to ARPA, on how to improve the situation.
And who has to implement, state themselves, or the
Predominantly the
state
state.
legislature have to get involved, or just the state?
No, but if it goes beyond the ARPA funds, they'll have to look at legislative
Well,
changes.
I mean, I know I bring up, I don't know, because I know we have a couple area legislatures running committees that deal with this subject, and I hope that we
Yeah.
can reach out to them primarily to get their involvement, and this is a big need. You know, we all know it's a big need. Well, I don't, Parkview, I know it's a big need just Parkview, but I know Beth, you've been concerned, and we've been concerned not just Parkview, but every caregiver, I mean, Nicole, we had a fellow board member, Bob Peschel, worked for one of these home care aides. He left there because he was just working. He was survivor, he was working too much himself, so it's a big issue that has to be addressed. And
And if you remember, Pete, one of our former board members, talked about one of his friends who couldn't get support. I think that from a legislative standpoint, between the actual studies and statistics, I mean, we've got real numbers, as well as those anecdotal stories about people literally dying from lack of support. I don't think there's a question about the need, it's how to address it. So they've been working really hard on a plan. If you'll remember last year, I also sent you guys a spreadsheet about how many referrals an agency would, could, should take if they were fully staffed. And there was a little couple agencies that didn't respond to us on that. But it's a real thing.
Well, and I think the only way to address it, right away is just like, again, trying to be proactive, trying to help people before it gets so bad that they need to get into a facility. Like,
Yeah.
how can we age in place? How can we help people? How can neighbors help? How can we garner natural supports? Like, how can we, as a community, help each other and save the facilities for people who really need it and are at that point? You know, and it starts with some of the things that we're working on in our age-friendly initiative, and it's social isolation. Like, how do we get people connected with people? How do we get people connected with the YMCA and positive things in the community so that they, when there is a concern, they have people that they're connected with, that they can talk to and that can help them out. How do we get people to stay active so that they don't have significant health issues? And that kind of all starts from the ground up. And that's some of the things that we work on here at the ADRC that we talk about consistently and as a community, like how do we not let it get to that point?
This just reminded us of some efforts on hiring immigrants to do this, particularly for fellow immigrants. And that is one of the other things that the state is looking at, is how do we really tap into assuring that people who are refugees and immigrants are able to enter the workforce and help out with the problem. Liz, I think is a question.
Oh, no, that's okay. I always forget what the policy is. I can wait until we can all chat about it, but I'm
Go for
so
it.
up during the meeting, the president's visit to El Paso this past weekend that I found out about nursing homes. So anyway.
Beth, Winnebago County, ADRC's got responsibility for 2,000 folks, 5,000 folks, 10,000 folks. They're trying to get at what Nicole was talking about. In terms of get a, a feel for the size or the problem.
It's hard to tell because you've got people who are in a managed care organization or IRIS.
All right.
And we could get true numbers on that. There's a number of private paid people. So as far as like overall number of people who need service.
Yeah.
I don't even know how we get at that.
Yeah, I
Well,
think
it's
we see it manifest more in delays to, when we send, people need help, so we get them hooked up with family care or IRIS, there can be a delay because they can't find an agency to serve that person, so I think that's where we see it most.
I guess what I'm trying to get at is just the notion of when one looks at data, you can see very quickly if we have an unmet need of, say, 500 people, well, that's, here's what it is, and, legislators, county board folks, what are you doing?
The other thing is when you say unmet, so there's unmet can also be people who would count as a person served, but they're underserved.
Understood?
So they might have someone coming in 2 days a week instead of 5.
Yeah.
They might be in their home struggling when they should be in assisted living. So it would be hard to measure what that gap is, not only from who's in it and who needs it, but who's in it that doesn't have what they need. And that's a lot of what Nicole's talking about. And we've talked about how we just talked last week about adult protective services gets a lot of referrals for someone who is in a setting, and all of a sudden staff say on Monday, by the way, we have no staff for the weekend. For a severely autistic person person with autism, not bad, who is about to have no staff. So where do you count that in there?
I do have to say though, with regards to adult protective services, there has been a decrease in the calls coming in for people needing placement. There was a time in the beginning of the year where we were getting constant calls for people having notices and needing placement. I think the concern that's going to be coming is the fact that people haven't been paying their cost shares and things like that. So we've been getting a lot of calls, a lot of investigations on people who haven't been paying their cost share. And at this point, and Brian probably knows a little bit more about it than I do, but because of the federal protection, they can't get kicked out. But once that, and it's coming, I think we just saw an email about it that in the next couple of months or this year, they're reevaluating people. But once that's gone, they will be kicking people off services, and that's going to significantly impact all of the people or their guardians who haven't been paying their cost share.
So here's a kicker to that not everyone thinks about. So we're aware that people getting services aren't gonna be able to because the public state of emergency will be ending and they'll have to get a review and they could get kicked out. However, there are a number of people who work in this system as a caregiver. And the number of hours that they work didn't matter, or the fact that they work didn't matter because they still got their benefits. Again, no one can get kicked off. Come this end of the state of emergency, the state is anticipating a large number of people who are either gonna have to significantly decrease their hours or stop working so that they can stay on benefits. And that's going to affect our workforce shortage. So it's about to get worse. Not to be a Debbie Downer, but I mean, that's the reality is that it's about to get worse because people are like, oh, I make some extra money and I can still get this. About to end.
When is that going to end, Liz? I mean.
I believe that they're looking at now, April 1st. But that doesn't mean everything automatically ends April 1st. It means that effective April 1st, people will start having reviews. So they'll take 1/12 of the people receiving benefits, and every month one of them will be reviewed. Doesn't matter when your review date was prior to the state of emergency. It's 1/12 of the people every month will get reviewed. Starting, April 1st.
You don't have.
So there's no way to get ahead of that and know who might lose their benefits, or is there?
A little bit. There's some people who we know are getting benefits that we've been proactive. Brian was working with some young adults who we know have to switch over to their former benefit. But because we haven't requested information on income, we as a economic support haven't requested information on income, we don't know.
That's pretty scary.
We literally have people on institutional medical assistance who've long since gone back to their houses. That because they couldn't be kicked off because of the public health emergency.
Yes.
So institutional medical assistance being paying for services into the home. So it's really gonna be a mess.
It really is.
And you don't have,
When you say the people aren't paying the cost share. Could you give me a definition of cost share?
Yep, to receive medical assistance, some people don't pay anything and they get medical assistance, and other people have to pay a cost share. Could be $20 a month, it could be $50 a month. If you don't pay that cost share, then you lose your medical assistance. If you lose your medical assistance, you lose your family care benefit or Irish thing.
That training, did they talk at all? Because, you're right, we've been at this for 30 years and nothing, earth shattering has changed. Is there any thought about, to Paul's point, putting the feelers out locally to be able to have like steering group or someone to understand what the situation here is in Winnebago County and work with those state folks? Because it seems like we're going, again, probably nowhere,
Yeah,
Did he say anything about that or?
he didn't, just that it's gonna be more of statewide programming, so that the eligibility to be a CNA quicker, easier, the increase in pay, the refugee immigrant part of it, the certification, it's all gonna be offered statewide. So I don't know if they were necessarily interested in hearing about pockets of the state that are,
I sure think that our health services central office, I sure would say to somebody, get your arms around this in terms of numbers and where the impact is across.
They probably have someone at the state level who has a better idea and just isn't sharing it, I'm guessing. They've got people that are gotta be looking at it. But again, because people have, from a medical assistance standpoint, because people haven't been reviewed and haven't been reporting anything, who knows? And that percentage of people I just mentioned who may be over income to be eligible and they're about to put themselves back into eligibility that won't be affected, so.
It'll take a while to unwind it because of these reviews being staggered, so it's gonna take a while, but our ADRC is gonna be a lot busier with disenrollments,
Correct.
family care and stuff
So
like that.
realistically, we're looking at probably 2 years.
I don't know about that.
At least a year,
year.
at least a year.
Well, 2 years of term, a year of reviews plus all the,
Correct. And it doesn't start for 4 months, so
Yeah.
close to 2 years, yeah.
So we don't have a number of how many people are in Winnebago County?
We do, and we have a number of people in Winnebago County who receive medical assistance. We don't have a number of how many people will be affected when the public state of emergency ends.
Because we kind of don't know their situation, you know? No, we do the
Yeah.
review, so.
So I can not only tell you the population, I can actually tell you the number of people receiving MA. I could go across the hall and do it right now, but we don't know how many of those people will be adversely affected.
So couldn't they be sent some sort of notice or something like that, or are they going to be?
They will be.
So
They will-
they're gonna know before that, and they're gonna look and say, hey, I'm in trouble here.
Yeah,
You're
so they will
also-
receive, yeah, they will receive appropriate notification. It can't end the day that they get the review. They'll receive appropriate notification and they'll also be given appeal rights.
But I can definitely say that, the care management agencies for the last 2 years have been calling adult protective services when people start getting behind, because they want to get in front of it. They don't want people to get kicked off when this ends, so they've been giving us like a heads up. So that we wouldn't get involved with something like that, but we've been getting involved, and, it's a lot of people who know that they can't get kicked off and aren't paying it. And I mean, I just got a referral today, like they'll get in trouble and then they'll pay, and then they're like, oh, now they haven't paid for 3 months again, and then we call them and we yell at them and then they pay. And
Those aren't of recent onset, that's usually a pattern of paying bills
Yes.
for their.
Yeah, well, pre-pandemic.
Any other questions or comments for Nicole or Beth or for Brian? To be continued.
I think from an APS standpoint, I think Nicole is trying to standardize a little bit what they do, and I think that's a really good thing. Being more consistent from staff member to staff member. We can see that on our side of the house, and so that is
Brian,
very welcome.
could you talk a little?
Sure. I was just saying, I think that Nicole's doing a nice job of trying to standardize the way that they do adult protective services, so that whoever gets called out on a situation, that response and also the paperwork is going to be consistent from staff member to staff member. That has been a problem over the years.
Beth? New community,
Yeah, so I have a
Community-
reason for being a minute late. I was oriented a new committee member and talking to a prospective one. So I'm kind of gonna skip over Jim. Well, we'll do introductions online, so the people that are on Zoom can also tell us who you are and why you're here. I'm gonna kind of skip over Jim because he's here, scoping us out, and hopefully we're gonna hook him in to become a soon-to-be new member. But I'll start, Jan, if you wanna just share a minute about, kind of who you are and why you're on the committee. He's unmuting.
Okay, can you hear me?
Yes.
Okay, I'm Jan Olson. I'm more or less represent the rural and the Winnebago to Amarillo area.
Kate?
My name's Kate Fentner. I was from the Winnebago area. I was born and raised in Oshkosh. Sat on the Community Foundation in Oshkosh for 10 years and the Winnebago Foundation for 6. Now I'm back on that committee. I have a daughter with mental health issues, and my husband had young onset dementia, frontal temporal, and had a brother that was developmentally disabled. So it's all a really good fit.
And Jim will hopefully share something with us when he joins us, but he comes from a kind of diverse background like that too. Rob?
I'm Rob Patterson, and I'm from Oshkosh. I represent the disabled.
We'll just go right around.
Hi, I'm Michael Robinson, and I also live in Oshkosh, and And, I represent one of the Winnebago County Board of Supervisors for District 15. And I got involved in this to help out the community.
Paul?
Paul Janty, Chair of the committee. My background is I used to work on it, Winnebago as a patient. I'm actually. Yes.
No, that's.
No, I was one of the administrators. And my background is I have two kids, both of them have mental illness. And I'm also qualifying as a senior, so.
Mike Norton, Winnebago County Supervisor, District 20 from Oshkosh.
I'm Harold Singstock. I represent the elderly.
Where you from, Harold? Where you from, Harold?
City of Oshkosh.
Like Liz last name. Thank
Oh, yeah, Liz.
you.
Hi, I'm Elizabeth Jones. I'm coming to you from the southern part of Neenah. I'm at home right now. I am the mother of two sons. Both are on the autism spectrum, although one has, high skills. But the other is Clayton. How old are you? He's and he has classic autism. And that's my story.
Thank you all. So, we have our newly appointed, committee member, and Brooke, if you want to share something with us about who you are and why you're here and what you.
Sure. So I work in home care. I'm a service coordinator for one in Winnebago County. So I know a lot about the struggles that home care has had. But then also I've worked in special education, and I have an interest in working with people with disabilities and advocacy, and like you were saying, being an ambassador for the AGRC, I think is really important. Knowing the resources in the community is something that's really important to me. So like the food pantries and things, I make a point to connect with all of those, and so that's why I'm here. I live up in Fox Crossing though, so kind of more on the north side of Winnebago County, and that's how I got here. Yeah.
Thank you.
Now, your name is Brooke.
Slick. I got married. I know Raj.
Okay.
So before we proceed, and again, thank you for sharing. I just wanted to know if you had any questions for us, or, to help,
I have a lot of questions, but I don't know the backstories, so I'm not sure where things are or what they're, but it looks like I can see you had a big project and a lot of stuff going on, and at least that could be kind of interesting, but also frustrating for you because but it's always fun doing good stuff. If I can say who I am, my name is Jim Lauer. I'm from Neenah. I've had from a big family. I'm one of the second oldest out of 12 kids. I've been the president, coached and managed the Neenah baseball program. And when I was there, we developed more of a handicap baseball program. And we were one of the first ones to do that in the Fox Valley. We modeled it after the Little League Challenger program. It's still going, and that's been about 25, 30 years. And I recognized, and the Park and Rec group up in Neenah was very helpful with us because they understood that you needed the community and the people involved in it to do the things that they couldn't. And so we could be, because we were moms and dads and involved in the stuff, we could do the things more on a daily basis that the city couldn't afford, couldn't manage. And so I spent time on that. Unfortunately, I had a job that moved me around the state quite a bit and I traveled. But I've recently been exposed with elderly parents, an uncle who just passed away on Friday, who I got involved in his health care that Beth was kind of alluding to, or I talked to her, was we had a guy who was living in his home who was proud, and we couldn't reach him. We didn't know what the resources were. He didn't know what the resources were. He didn't really want to go out and look for them because he was afraid, because his finances weren't there. He was trapped in this house, and ultimately all everything fell apart on him and we stepped in, a few of us, his family. And we found answers and we got him help. We tried to make him safe. Initially, it was put him in his home and try and make him safe in his home, but his health just failed enough where we couldn't do that. But he passed away on Friday and he was a man who died appreciative of the fact that he didn't have to worry about money. He didn't have to worry about where he was gonna eat. He didn't have to worry about how clean he was gonna be. He could really live out his last few months and in that. And I looked at what he was going through and I said, yeah, I'm kind of interested in helping out more, and especially now that I'm retired. I have some time and I don't need a, super job, but I'm interested in working on something. So that's why I'm here. So I'm curious to know where it goes and what it leads to.
And really able to represent all of our target groups should he choose to. join us.
So,
Thank you.
thank you.
Thank you.
That we forgot to introduce our other
Our
new special
newest guest
guest
from-
guest.
From Public Health.
Sure, yeah, I was just going through board members, but yes, I didn't do staff, but yeah.
Okay. This has been this committee a lot. I'm Lori Duquan from Winnebago County Public Health. I have about 22 years of experience in public health. I do, part of my job is housing. 50% of my job is housing authority. I'm a housing authority nurse over there. And then 50% of my job is working with our aging population within the county. And I also do some HIV counseling and testing and partner services for those who are newly diagnosed.
Returned to the
Welcome
scene
back.
of the crime.
I know.
Yeah.
Glad to have you back.
Yeah, I'm glad to be back.
You have anything else, Beth?
Let's see, what are my other topics? One question I have is, right now, these meetings are recorded and posted on the internet. And they're also being completely transcribed, and then I spend laborious much time going through the transcription to narrow it down into the 4 pages that you get or more. My question is, because you can go back and hear the recording or see the recording, should you want to get the level of detail you might want, is that still necessary, or could we look at a condensed version of the notes? Like some committee members do that say adult protective services presentation, Nicole presented information about statistics, blah, blah. I don't know.
Yeah, Mr. Chairman. For me, and, I'm on the county board, so was Mike, so was Harold from past. Many committees have very condensed, they'll just tell you the very, very basics. They won't go into much detail. For example, Nicole gave a very thorough report, won't go into that detail.
Exactly.
You might get us, the statistics, but I advise what we do with our health board now is, if there's certain things that we think we want to hear, like some statistics that Nicole gave, I'd like to know, you just send that later in a different note later. It doesn't have to be part of the minutes. You're right. Very simple. If you have most of the things, yeah, you have to have that, maybe basic things if you have to highlight, but no, the detail, we can go back and we can watch the meeting. So that's the same as, I would say, most of the committee meetings at the county level.
That's why I'm questioning, because it's a lot of time to transcribe it and a lot of time. And I don't know that level in writing is nuts.
Isn't it the case that if they did have a question, if something was a little more vague than they wanted more specific information, they could bring it to this forum in kind of an old business type.
Yes.
So there's a way to get more in depth if we needed to.
Do we have any questions from our Zoom friends?
I would support very minimal notes with references to the recording. The recording is obviously a record of what happened in the meeting.
We didn't used to have that, but now that we do, that's what kind of prompting me.
I agree with Liz.
Any other questions or comments? Sounds to me consensus is short and sweet.
Okay. And then the other thing that I had is that at next month's meeting, you'll get a dementia services update from Melissa. I will be going through our conflict of interest, which is an annual requirement. You have to sign it for those of you here. I'll send it to those who aren't. And we do have a new 2023 scope of services that, I'll probably email to you prior to the meeting. And then I'll put it on the agenda if you have questions about it. I don't think we'll go through the whole thing because it's, a large document, but those are some of the, items we'll be talking about next month.
Anything else?
Unless
Ryan,
you want something else from me, you know, I always jump in.
I know. Ryan,
From my side of the house, things are continuing to be very, very busy. I think I reported 50, I can't remember what the exact number was, but 50-ish packets, enrollment packets to family care and Iris. But we were at 52 this month again, so not a lot more, but that is humming along really a lot more than we usually do. So that's all the eligibility and signing people up for family care or Iris, the programs to get help into their home for them. So staff is wearing it on their auras. I think they're pretty busy, a little bit stressed out. Beth and I are, I have a team meeting tomorrow morning at the Coghlan Center, and we're doing a kickstart for 2023, just because it's been tough, kind of alluding to what Nicole had said. You know, seeing so much more need-based calls, which is what we do, don't get me wrong. But sometimes there aren't good answers for those folks, and we get into the helping profession to help. And so, you know, that's a bummer for our staff to not be able to provide good help. But also part of that is understanding, who do we serve? What is our target groups as an ADRC? And helping to provide information and referral to someone with mental illness. We're seeing so much more of that. To provide a good referral or a good handoff to our behavioral health unit and not have to try to muddle through that as an ADRC staff, because we're not the experts in that. So hoping that the discussion goes well tomorrow, that we have some good thoughts and solutions on how we can be better, but yeah, all I can say is just busy. We've had some staffing issues in that. Our MA assistant position is now open. Once again, that's that liaison position that helps us with eligibility for medical assistance, which is part of getting hooked up with family care and Iris. So Beth and I are taking the bull by the horns with that and going to start interviewing again for that position, because it's such a needed position for our staff. So other than that, nothing's going on, but it sure fills up a day.
I have a question. Yes. I think it's appropriate to ask you, Brian. You say we don't have any staff on weekends, right? Is that because we've never had any staff, or is it even thought about having someone on staff on call? I bring this up, well, you might know, because that's being brought up at the Human Service Board meeting, it's being brought up the county board level, and I guess. Why do? I mean, you can answer that question, and my response, and let you respond to that, is if we have people on the weekend, we have no one to take care of them. Why? Maybe we should have a person on. That's fine.
I think germane to that question is, I mean, first of all, we're the county system, so we just typically haven't worked weekends in the long-term support division. But I think our work on my side of the house isn't necessarily emergent. So I feel like there's a way to do that proactively throughout the week and not have to really, because we do eligibility processing, you know, is a lion's share of what we do. So I think that can be done in the 5 days that we do it and not have to have all the staffing costs on the weekend.
I understand you need a break, but what do people do then on the weekend? That's the thing.
Are you talking about adult protective services or ADRC?
Adult protective services. What
I
I mean,
mean,
educate me.
Our crisis team responds.
Okay, so it's re-educate me. I think there's an elderly person or someone who has some kind of situation. And instead of taking that person to a jail or something, someone intervenes and will take that person. That's what we have a crisis center for. Is that where we take it?
No, if it's dementia and not a mental illness, they don't go to the crisis center. No, but a crisis worker can respond. They know what the resources are that we use. The police are typically involved with those situations if there's a need for an actual court action to place somebody. But typically, it's crisis diffusion at that moment, and then we pick it up the next working day.
Do you ever advertise that number for the crisis?
It's all over the place. What is it, 233-7707?
It's wondering, because
So the only thing that would happen on the weekend would be what I talked about, which would be an emergency protective placement. And then we did 31 of those and 21 of those got thrown out because they weren't appropriate. So I would say that there's really not a lot that adult protective services can do because of the fact that if, for instance, there's an emergency, the police have the ability to do the same things adult protective services have to do. Crisis has the ability to do those things generally. So in order for someone to get emergency services through adult protective services, they have to be incompetent. And that's usually because they have a degenerative brain disorder. And it can't be because they're having a mental health issue. If someone's having a mental health issue, it has to go through behavioral health. Because in order for adult protective services to enact an emergency situation, the person has to be, a doctor has to say, this person is likely to be incompetent for the rest of their lives. It's not something that with treatment that they can get better. So most of those situations for adults would always go through crisis or behavioral health. Generally, when someone has dementia, and that's why we're really working to make sure that it doesn't become a crisis when someone has dementia, that once we find out about them, we get them involved in programs. And actually, I'm bringing on an intern who's coming next Monday, who's going to specialize in dementia, so she can support our dementia care specialists, and she can get out in the community and teach people and handhold people and engage them in dementia programming, because there's a lot of resources out there for dementia. So there's no reason generally for dementia to become a crisis if they get the support when they start having memory issues.
And the other thing is that the crisis, after always with someone with dementia, is typically the caregiver who's in crisis. It's not often not it's the behaviors of the person with dementia that's causing the caregiver to really struggle with being able to support them. And that's not an APS issue. So.
Question.
Mhm.
I was curious, I heard you say that 62% of the people are leaving. Did you say that? The caregiver is 62%, there's a turnover of 60%.
Yes.
So are they leaving the trade in a sense, or are they just moving from one place to another place to another place? And they're still there?
Great question. I would say both, and Brooke might know a lot about that too. When I ran a home care company, generally I would be getting someone who is like, oh, I used to work for so-and-so, and I'm gonna work for you for a couple of months, or I used to work for the skilled nursing facility. We didn't get a lot of people applying coming from that had never been in caregiving before. It was a lot of people going from job to job to job, maybe because they were mad about their schedule, so they wanted to work somewhere else. And definitely there were some people who maybe had never done caregiving before, but I would say that a lot of people are going to different companies, trying to get something better, maybe trying to get the sign-on bonus. There are a lot of sign-on bonuses out there, so they would work somewhere for a while, get a sign-on bonus.
That's what the 3 points that you brought up, for pay, benefits, and scheduling. To me, it sounded like, oh, we got people hopping around trying to.
But I've noticed lately it's different than before, that we haven't had staff stay in 3 months since we hired. We haven't had a new staff member stay more than 2 months.
Isn't that crazy?
Yeah.
So that seems like a problem.
Yeah, they're not even
Staff.
trained at that point.
Yeah, I mean, it's gotten pretty bad, more than even during the pandemic. I've noticed that we haven't taken referrals, nothing. We're at a complete standstill basically with the company I'm at.
Rob, to your point about the crisis number, we do advertise that a little bit in that we have business cards that we hand out to people, and also we all have that on our voicemail message. Like if someone were to call me or call Beth, It says that if you can't find me and this is a crisis, please dial that 7707 number. So we do try to promote that, always have, as I
Yeah,
remember.
yeah. And like you said, if we're involved with somebody that we anticipate there could be a crisis, we always give that number.
The other concern, if there is a crisis, is that the only time the hospital will admit someone is if it's medically necessary, and they are not gonna admit someone with dementia. So we don't have a facility, we don't have anything in our back pocket, that if someone is in a crisis and has dementia, generally we try to get the family to step in and help out, because we don't have anywhere for them to go. We don't have a single facility that says, call us and we'll take it on. So even if, let's say there was a crisis and someone had dementia, there wouldn't really be anything that Adult Protective Services could do. The police might have a better chance of getting someone to take that person. While I've been working at the day by day now for a while, they do bring a lot of people there at 1 o'clock in the morning if there's a crisis or if something's going on. They have been. So unfortunately, our crisis facility is not set up to provide any medical care for someone and or the level of care that someone with dementia needs. So they can't transfer, they can't help them with diabetes care. So it's, even if they were like, yes, we can take them, they don't have the capability to take that on. So unfortunately, there's not a lot to do, which is why being proactive and getting people involved in the services that are already out here is so important.
We've already said that. Okay.
Alana said she didn't have any updates for strategies, right now, as everything is the same as we talked about before. Alana and I are going to transition, so when she needs to come, she'll come, otherwise, we get to have me. I see a lot of the same things that you guys talk about at the table, especially with our housing people. Many times they're on family care and they don't have people to come in and help clean. I think that sometimes pay is a big issue. If you can go to McDonald's and get $15 an hour and you work, and only get $10 an hour, yeah, I don't know what the rate of pay is. They're gonna go to McDonald's. So, I mean, it's a difficult situation, but you're right, it's been ongoing since I was a nurse. And so that's a long time. And in nursing and healthcare, it can be very mentally demanding. And so it is hard. I worked at a nursing home when I was a CNA. So those things can be very difficult. I don't know how we can change some of that stuff.
You know, I have a question, maybe I should ask when Brian was up, but, what has become of a program that you started last year of the snow shoveling program? And I remember I said at the time, I said, can't we get some of that started and try to get volunteers to do more of that? And I remember a year ago, when I was in Washington DC at the February meeting, and I told you what we learned about what one community does, where they send a physical therapist, a nutritionist, to as many homes as they can. And I asked if we could look into this like that. And I know Beth and Brian and Nicole, that's hard to do, but how do we get that started? Because Roy is right. I mean, we talked about this. Roy used to be head of a aging, a group of the dealer senior issues, and it's been a big problem. How do we get people to help the elderly, keep them active, keep their houses clean, keep them nutritional?
And that's part of what those programs that we talked about, like through Share the Care, and Jan had shared one with us, Liz had shared one with us. There's programs out there where you sign up for help.
So, and I remember one program, Roy, if you remember, we were talking about handyman program. Remember we talked about that? I don't know if anything came about that, but how do you, let's say you just need someone who's elderly who needs some help. I mean, could we develop something like that? I know it's gonna take time, and I know But I think it's very much needed.
I guess I feel there's so many platforms out there right now for it. We would just be another platform and then someone from here would have to manage that platform.
And is there a, well, how do we hear this? I mean, do they call here and they find out this platform? Or I'm, you know,
Well, one of the things that we tried to do with our snow angels, which we're still doing, and we took on 2 new people this year. And that we tried to do is I reached out to as many local businesses as I could think of to let them know the opportunity to do this, like to replicate it. And I was willing to take it on so that I could set it up for them and pair people. And the only one that allowed me to come was for Imprint. They just allowed me to have a Zoom meeting with their volunteer coordinator. And so I worked with our intern to come up with like a flyer and how to do the program and that I would be willing to run it for them to get them started. And I never heard back. I reached out to Oshkosh Corporation because it's a big corporation. And I did get in and I was able to run a women's group about the ADRC and the things that we offer, but they weren't interested in hearing about snow angels. So I'm happy if anybody has a connection to any local businesses to present, to help do that. The problem I think that we run into is that I run our outreach committee. We have the ability to, and we have the people who are passionate about it, but it's getting people to give us a chance or to listen. It's kind of like who you know.
Could you tell me, I don't know anything about the snow angels, what is the basis of?
I was kind of laughing to myself. I think you're looking at about 98% of the snow angels at this meeting.
Why are you going to company, what are you asking them to do?
Sure,
Wasn't
so,
that just you and Brian, I think?
And me for blowing my knee out a couple weeks.
Yeah.
Yeah.
so what we did was we sent out an email to all of the staff who work here. So everybody has to take lunch. And so we sent out an email to all the staff who work here and said, if anybody on their lunch is willing to donate their time to any neighbors in the area that need snow removal. And so we set up a group, and when it snows, we email our team of me and Brian and Beth to see if anyone is willing to shovel or can make the time. And so myself, Brian and Beth go and we shovel people's driveways Monday through Friday, anytime that it snows. And we've done a really good job of it the last few years. Like, no matter if there's one of us or 2 of us, we've gone out there, done some pretty big driveways. And we're trying to get it to catch on to other businesses because it's something that we actually enjoy doing, no matter how cold it is. Every time I've done it, I felt really good about it. I do not shovel my own house. That's my husband's job. But I will help other people.
If you broke it down as a map and you found businesses in the map and said, this area is your area that you're in, you would be the best person to fill this space. Maybe if you made the space for them and then ask them.
We've been using the neighborhood association,
Oh, yeah.
so what we did is we reached out to the neighborhood association here and said, is there anyone who has a need? And they gave us 2 people, and then actually when people call the ADRC, if they're in this area, that's how we picked up our other 2 people.
Well, and I didn't call the snow angels because I have 2 wonderful neighbors that did mine when I had sepsis. And I couldn't do any snow. I mean, I couldn't even walk up the stairs without getting worn out. Or go from the kitchen to the dining room or to the living room. I was completely worn out. So I have 2 neighbors, one that lives next door to me and then one that lives across the street from me, and I swear to God, he comes over there. He says, no, don't you dare go out and do it, cut the that stone, don't you do anything. Oh, they might be interested in this. Oh,
have you reached out to service clubs? For volunteers? Have you reached out to schools? You know, these are the people I mean, a lot of the people who are the day by day ones, okay. At nighttime, they have a place to stay, but maybe for a little help, maybe they will help out some help someone else do something today, maybe. And that's what I look to, I mean, schools, service clubs, you said the neighborhood, those are fine, try to. And like I say, Beth and Nicole and Brian, I know you have a lot to do, but I heard of this program. I think it's a great idea, so I saw someone on Facebook or something, hey, I'm available, anyone needs, and you're gonna do it for free, and I go. Why is this? And I thought this is what you were trying to do. Why don't we try to reach out to the community, maybe even on that more and say. And do it that way, because it should just be 3 people. It should be,
Right.
There's a couple more.
and when Brooke said, when Brooke, it should just be an honest, maybe, need them and that's my, I mean.
Cool.
That's all you get, what you get, the call.
Want to help, and I
That's
think
all you get,
connecting,
but
I mean, that
when I hear
connecting an
these,
entire county of people who want to help their neighbors is a hard challenge. you know.
Even within our own agency though, and it's, everybody's busy, so people have lunchtime appointments and stuff, but I think us 3 are. I mean, this is a great idea. I think it's amazing. And like. That level of commitment has waned a little bit within our agency.
We have over 100 people here and we have less than 10 that are.
I'm not, what I'm trying to say to Nicole and you 3, is not just depend on people who work here. I'm trying to get the people who are in schools, who have time after school. I'm talking about service people who are retired, who, you know, who may be able to shovel it. Those that we get a little more.
And to be very blank, I appreciate Nicole's efforts times 10. We don't have a volunteer coordinator here. And it is a full-time job to try to build something like this and connect something. You have wonderful ideas. Every organization you just suggested would be great. We don't have the capacity, to be honest, to fully try and engage our community. But also, again, we not only are there media partners, but United Way does this. They have a volunteer coordinator and a volunteer site. Someone else, someone else says the volunteer coordinator, but why would we duplicate what's already out there too? You know what I mean? So it's a struggle.
There's already not enough hours in the day, to be honest, with the work
Give
that
another
we do.
question, give another comment, and then
I just was going to say that. I appreciate where you're coming from with schools and the service industry or the service groups like the Lions and the Eagles and Kiwanis and all those people, but. Having been in those groups, they're struggling to find people in there.
Absolutely.
And I'm feeling. A lot of work is being done here. And perhaps I think it's a social problem. That we need to get to the schools and educate our kids about what their responsibility is to their own community. And we can't just let these people hide. We have to teach them about accountability. I think
Right.
everybody in here is about same, or I don't know, I didn't mean that. Everybody here is from a background probably where you helped somebody else, got involved in somebody else's life. You did those things and you made a commitment to do something. And we need to get that conscience back into the community. And I don't know, is that something that would be a focus that we should be doing as maybe a side benefit thing?
I think that's where we've been headed, yeah.
Okay. So I don't know the backstory, so again,
Cool story. that we-
My comment is simply
Yeah,
wanted to make a list. One of our goals for this year was to make a list. One page or one page in the backside of all the different transportation options for the bus, the cab, everything.
Yeah.
I mean, everything.
Is that
And
something?
why can't, I'll take on the work if you want. To make a list, you know. Somebody will give me all the resources.
Mhm.
I can't type very well, but, that's another problem.
I've been sitting in my hands long enough.
Okay,
Just a quick comment about the snow angels, because it brings the point to the point what Mike's trying to say is. We have a little lady on, down here downtown that we shovel for last year, shovel for this year. And we went out and it didn't look like there was a whole lot of evidence of any like movement at the house. She's still there, she's still living, she's an elderly lady, you know, is she at the hospital, what's going on? So the second time we went, it got the better of us. So we grabbed her mail, not trying to be nosy, but we grabbed her mail and went to the door and knocked. And here she comes tottering out and she's doing just fine. Thanked us for being there. She's a 98-year-old lady,
Oh,
still driving and living in her own home here in
I would get
Oshkosh. So
someone
to
to help
his
her out.
point, like when we got caregiving crisis and limited amount of senior housing and assisted livings, this is societally where we should be. And it kind of brings in your point too. We've lost that with our society and helping other people and you know,
It also goes back to the study that, oh, what's his name?
Yes, yeah.
Yeah,
Jeremiah, yeah.
I'm trying to
Jeremiah.
picture in my head of elementary kids helping elderly people. And in a way, you know, where you just have like a poster, you know, help graph, you can be there, support kind of group. And I remember when my father-in-law, who was like 80 and my kids were growing up, and he would go for a walk with those kids, and as their parent, I would be like, come on, let's pick up the pace here. And my father-in-law was one who was, oh, okay, and he'd take that 45-minute walk for 100 feet with those kids because they stopped and looked at every bug.
Yeah.
And all this stuff, but they kept him young. They gave him a purpose.
Yeah.
They were also someone who got involved in his life and were willing to help him later. And I'm probably out of tune talking.
No, that's part of our actually aging plan. We were designated as a age-friendly community by AARP. One of the like 7th in the state to get that designation. And part of our plan is intergenerational activities. It's been a struggle to launch them because Nicole set some things up that just haven't been well attended or well looked at. It's still part of our plan and our goal.
I know from business when I was running the fire group for air gas, we probably would not have entertained a lot of talks coming in because we were really profit focused on our thing, and our social conscience wasn't as good as what it could have been. And I don't know if anybody's gonna change that because, you know, we were driven by bottom line, by performance pressures, and, you know, we had the same problem with our people that you, when you post a sign here and say, you know, we've got 100 people in the building, can you sign up for this? I had the same problem with 50 people I worked for me, because you know really well so many times, and then you tap out, and so. But if there was a way that I could have gotten those people vested in the program, they probably would have been more willing to be their own contractor in a sense, helping and doing things.
And I don't want to cut people off, but this is not an agenda item.
I'm
So
sorry.
I'm happy to put this on next month's agenda.
please.
Right now, we're doing updates, and so we kind of went off on a rabbit trail. No, that's not you, the whole group has had a very meaty discussion that I didn't want to end, but technically, we're supposed to stick with our agenda, and we just doing updates. So I'll add it to next month's agenda.
Harold, anything?
No, I don't, Mr. Chairman.
Liz, anything to share with the group?
Well, I had my hand raised and oh yeah, somebody had asked a question about whether or not the caregivers were leaving the profession rather than just moving from one agency to the next. And so I did find, you know me, I always pull this stuff up when we're having our meetings, but I did find an article from July of this year, that anyway, that says that apparently there are large percentage leaving the profession. It says, for example, jobs in retail in Wisconsin from December of 2019 to December of 2021, so for 2 years, in retail fell only 1.7%. But in nursing and residential care, employment shrunk 13%. So that's a huge difference. And so now that statistic in and of itself doesn't mean it, but then there are some experts who are quoted in this article saying that they are actually leaving the profession partly because of wages and also partly because of working conditions, especially as you guys mentioned, not being able to have a schedule that you can count on. So just thought I would bring that up. I don't have anything to report necessarily. As you all know, Friends of Autism is not in existence anymore. So no walk for autism this coming year, as far as I know, but if that changes, I'll let you guys know. Thanks.
Thank you, Liz. Jan?
Nothing from the community. I am gonna be gone February and March, but I'll try to zoom in if I can from Florida.
Come on, Jan? Anything from,
Maybe you meant me. I don't have anything today. Thank you.
sorry. Jan, okay, sorry. Mike?
Two things. First of all, the housing, what's the group, did you lead up? The neighborhood association money, what's that called again? Help me, that.
The what?
The position, let's help people.
Oh, the help program.
Okay, help.
Yep.
When are you gonna be, I know I've asked you before, when you be ready to make, especially to the county board, because, when we gave money.
Yep.
Or
Yep. The
the
program starts on
Maybe-
Monday, so we need some time to get some experience.
Well, okay, because my colleagues want to update on all 5 people who placed the guy for some of that money, and you're just one of them.
Yeah.
I don't know if we're having a meeting in March. You let me know if you're ready in March, because that's a special meeting. That's one thing. You let me know and I'll talk to the chairman. I
Okay.
know we're having one in February, and that's why I don't want to rush you, but
That will be preliminary, too preliminary. Yeah.
that's correct. And then secondly, could you prepare something either for next month, be February or March? Because I'd like to have a resolution, May as National, where's this? Autism Awareness Month, because there's a couple of things one thing I want to make part of that resolution about have blue lights, like they have the green lights for veterans, and I have to have that as part of the resolution.
Okay,
And I'd like to have it passed by the county board by April.
sure, no problem.
Thank you.
Rob?
Just a note. So April is Autism Awareness Month. So April 2nd is International Autism Awareness Day. So that's the day you would light it up blue, April 2nd. I mean, it's the
That's
whole,
funny. Good checking on that. I thought it was April.
Yeah.
See, that's why we have you on your list. So
no,
I'll get it to you very soon.
February or March, okay, I think.
Absolutely.
Rob?
Yeah. I found a rather heart-wrenching article. It's about the care in question at the veterans home in Canaan, Wisconsin. It told about 2 cases of people who died. One went out for a smoke, and nobody knew he was outside. And she basically caught a fire himself. He died from burns. The other article was, or the other case, basically said that the person who had diabetes was recovering, and it turned out that his the diabetes had checked for a while, and he died too. So I've got the paper, so if anybody wants to see it, but that's a brief
All
summary.
right, pass it on my way. Thank you. Thank you, Rob.
And I can understand it from both sides, because I worked for a short time in the CNA, and this was back in the 1980s. a long time ago. But, yeah, the amount of work that they have to do, it's not worth the pay. So that's about all I have.
Thank you, Rob. Mike?
I don't have anything.
Brooke?
Yeah, I just wanted to mention, we were talking about home care. One of the really big reasons that people are leaving that I keep hearing over and over again is that the need for actual personal cares is going way down, and the amount of people who are just looking for cleaning and housekeeping is going up, and a lot of the caregivers are not liking that. And so I wonder if there's any, with the ADRC, do they have any connections with just cleaning services? Because I've had caregivers who actually left caregiving to create a homekeeping business.
Yeah.
So I wonder.
Yeah, we sort of do. Part of the problem with that is that when we are paying for something, there's a limited pot of money per person.
Right.
And
Okay.
unfortunately, cleaning companies charge $60 an hour.
Right,
And home care agencies are at still the 20 somethings.
yeah, 24.
So you get half the service. So a lot of people are still trying to find a home care company who will do the cleaning just because it's cheaper than a cleaning company.
And that's become a huge issue where people are leaving the home care to begin with.
It's a good
so.
point, though. Good thing to recognize.
Yeah.
So why, are they leaving because they don't want to do the,
House cleaning.
Because they come into it trying to care for people and to rehabilitate certain things, physical therapy and to assist with those, and then they actually are faced with dishes and, all day, every day, they're just cleaning over and over, and it's very repetitive and hard on mental health.
That's a really good point.
And it's
really
I've had
because the
someone give me-
clients, is it because the clients are choosing to do the house cleaning chores rather than the personal cares?
No, it's actually in when the referral comes in, that is their referral, so it's not anything that they're like
Oh, got it,
meeting us, that's what they're just asking for.
got it. I
Very
actually know a woman like that in Wapaka.
It's not that we don't wanna clean, it's,
No, that's a really good
Yeah.
point.
But I also think that when I was running home care, like a lot of people went into it because they like the nursing aspect
Right.
of it. They want to transfer people, they want to do people's meds, they want to, and they don't feel like they're valuable and because they're sweeping someone's floor. And to be completely honest, a lot of times that person would be ambulatory and possibly able to do their own dishes or sweep their own floor if they wanted to. And so that even made people more upset that they were like, I didn't want this to be a cleaning lady. I went into it to make a difference and to connect with people.
I would say that's one of the top 3 reasons that I hear for people not staying.
And I hadn't thought of that. That's
Yeah.
very interesting.
Just to make a comment about that, I had recently did a survey out of the ADRC book, picked out 3 agencies in trying to find a person to actually do cleaning, not personal care, but cleaning and, just things that people with mobility needed, but not physical care. The average was around $30 an hour that the individual would be paying. The issue became that most of them those agencies have a minimum standard. So if you take on this agency, you have to guarantee that they're going to get X amount of hours per week. And perhaps they didn't feel they needed it, especially if they're considering the finances and paying out $30 an hour times 10 hours a week or whatever it was. It kind of varied with agencies, but I looked at things like Visiting Angels, Home Instead, and Bright Star, I think were the 3 that, though there's a lot more on the listing.
Any other comments or remarks that need to be made? Hearing none,
Get the motion to adjourn. and all
Meeting
your-
is- meeting is adjourned.
Hi,
Thank you.
everyone. See you next
Bye.
month.
Yeah.
Bye, take care.
Get your.